Hi. Hello. How are you? Good. Nice to see you again. Yes. How have you been? Good. Great. Good. I've been doing well too. Thank you for asking. I know I've been very busy. Thank you so much for coming in today. I'm so glad we were able to fit you in. Yes, luckily my patient after you canceled, so we do have lots and lots of time. Okay? So I understand that we have to do deep cleaning today, yes? Okay, how do you feel about that? Nervous? Okay, that's understandable. A lot of people get very, very nervous. I will say that deep cleanings aren't quite as bad as a lot of people think they are in general. Sometimes it depends on the experience, but for the most part, deep cleanings usually should be pretty simple, and you should be comfortable throughout the whole visit. Yeah. Yes, if you are not comfortable throughout the whole visit, please let me know. That's very, very important. I need to make sure that you're comfortable. So today we're going to go ahead and get you numb. We're starting on the right-hand side. So we're going to be doing the top right and the lower right. Yes. So you're going to be numb on half of the mouth, that side. So you will want to try to avoid having any hard foods today. Wait until you are no longer numb before you start eating. It's very important. You don't want to accidentally chew your tongue. Yes, and then you want to also make sure that you're rinsing with warm salt water. That really helps a lot. And I say to avoid flossing on that side for 24 hours. So until tomorrow at the same time, you can go ahead and start flossing then. But until then, please do not floss. And you can go ahead and use a soft bristle toothbrush. I have one in your goodie bag, so I will give that to you at the end of the visit along with some instructions. Okay? Perfect. So I'm going to go ahead and take your blood pressure, and then we'll go ahead and get you numb, okay? All right. We're going to go ahead and check your blood pressure, okay? So let me go ahead and get that ready. Okay, go ahead and put your hand out. Okay, good. Thank you. Good. So you're going to be feeling some pressure. Okay. Yeah, you've had your blood pressure taken before, so you know. Yeah, no problem. Okay. So let me go ahead and place this on. Okay. Go ahead and get this on. Okay, and I'll have you go ahead and stay nice and quiet for me. Get it so I can hear. Okay. 112 over 65. Awesome. Good job. Very good reading. So we can go ahead and continue with the appointment. Now that I have you leaned back, I'm going to go ahead and get you covered up, and we'll go ahead and put some topical on and get you numb. Okay? Okay, good. I go ahead and put my mask on. Okay, good. So I'm going to go ahead and put some jelly on, okay? So this is going to go ahead and help to numb the tissues in the area where we're going to be doing the anesthetic, okay? I'm going to go ahead and dry off the tissue first, and then we'll go ahead and apply the gel. Okay? Okay. Good. Now we're going to go ahead and place that right there. Okay. Good, and then dry off a little bit here on the bottom. Okay. Okay, and then I'm just going to place that gauze right there. Okay. All right, and you're just going to hold it there for about 2 minutes, okay? Yep. I'm going to go ahead and section for you. Make sure you're not swallowing all that gel. Just not tasty is all. Good. I'm here for a little bit longer. I'm going to go ahead and get my syringe ready, okay? Have it all nice and sterilized here, so okay, so that's how the syringe looks like. Okay, this is a petite one because I have very small fingers, so this is nice and small for me. Okay, let's see how it's loaded. Okay, so I'm going to go ahead and load it like this. And put the carpule, what we call this is the carpule. This little piece here has the actual anesthetic in. So this one is articaine, and it has 4% with epinephrine. So this is called Orablock. There's a specific name for this one. Okay, and the epinephrine helps the anesthetic to stay localized in the area rather than spreading throughout the rest of the body. Okay. So we don't metabolize it quite as fast. So it's a fancy way of saying it stays in the area and keeps you numb for longer. Okay, so we're going to go ahead and place the needle. Okay, so it looks just like that. Okay, that's our anesthetic. Okay, sometimes it helps to see all of this rather than being so scary and something that's, you know, a foreign thing. So, I'm going to just give you a little bit of section. I'm going to have to take a few draws here, okay? So I'm going to go ahead and put that down for a second, okay? I'm going to go ahead and just grab that in there. Okay, good. Perfect. I'm going to go ahead and give you a really good one. Okay. Alright, so I'm going to have you go ahead and stay nice and still for me. Okay, so I'm just getting rid of some of the drops of anesthetic over here, okay? So I'm going to go ahead and just move the lips here out of the way, okay? And I'm going to go ahead and get you numb here. Okay, so I'm going to go ahead and just pull the tissue out of the way. Okay. Great. Okay, perfect. So I'm going to go ahead and just start anesthetizing little bits at a time. Okay, great. Good job. You're doing wonderful. Perfect. Okay, good. Okay, great. I'm going to go ahead and do the area next to that, okay? Right there. Perfect. Okay, good. And go ahead and do a little section. Okay, this one's going to be right in the front here, okay? Okay, you're doing great. Okay, good job, good job. Okay, and go ahead and do a couple more on the bottom. Almost done. You're doing fabulous. You're doing really, really well. Yeah. I'm going to go ahead and bring back the tissue here on the bottom. Okay. Good, right here in the front. Okay. Perfect. You're doing awesome. Okay, good. And then one more over here on the side. Okay. Great job. Okay. Perfect. Okay, we're going to tap that back. Oh, just a little bit. Oh, they're fabulous. Oh, wow, I'm so proud of you. Great job. So really, how was that? Yeah, that wasn't really that bad, right? It helps a lot with the numbing solution. Yes, I will say that helps a lot. If you don't have it, it's a little bit more uncomfortable. So, oh good, I'm so glad that you didn't feel anything. That makes my day. Good. So I'm going to give you a couple of minutes, and then we're going to start getting ready to go ahead and start with your cleaning. Okay? You did such a great job. You did such a great job today. Congratulations. You did your deep cleaning. You did your deep cleaning on the right side, top and bottom. I'm so proud of you. Good job. Yeah. So I'll go ahead and take this off. Okay. And like I told you earlier, you just want to make sure that you're not having anything that's going to be too hard. Okay. So try to stay away from anything hard or crunchy. Things like nuts, chips, popcorn, things like that can get lodged under the gums. So we don't want you to have anything getting stuck under the gums, okay? How do you feel? Numb? Good. That's what we want. So you're still going to be numb for a few more, like an hour to an hour and a half, okay? For a little bit longer. So during that time, make sure that you're not eating anything hard. And I would suggest not to eat anything that you're chewing on. So liquid diet until you can no longer feel the numbing. Once that tingling is gone, then you're good to go. Okay, otherwise you can chew your tongue, your cheek. It does happen. So don't be that person. Okay. So I'm going to go ahead and have you make the next appointment with the front desk. So it's going to be in 3 months from today. Okay, and then we'll go ahead and do some measurements of your gums at that visit. We're going to recheck and see how things are going. Okay, and then we'll go ahead and get you scheduled for also your next dental therapy appointment, which is essentially like a cleaning. Okay, so we want to make sure that we're thoroughly removing all that bacteria before it starts becoming heavy and tenacious and really difficult to remove. Okay, so keep on flossing and make sure that you wait the 24 hours to floss. But otherwise, I will see you back here next time. Thanks.